Hello, everybody. This is Coresair Mack, President of the Illinois Mental Health Counselors Association. And today I'm joined by our very own special guest, Dr. Lucy Parker Barnes. How are you doing today?
I'm doing okay. Thank you for inviting me on here, of course. They're excited to share a little bit with you today.
Yeah, definitely. So, for those of you that don't know, Lucy and we have a little bit of history together. So, when I was in grad school, she was one of the doctoral students who actually taught a couple of my classes. So, I'm very happy and excited to have her back on here to interview her.
I'm excited to kind of come back around full swoop and also to be engaged more in the Illinois community again, too. This interview coincidentally works out with a job opportunity that's brought me back to Illinois. So excited to talk with you, of course, there.
All right, perfect. So we'll go ahead and jump right into it because all your fans want to know, how did you become interested in counseling?
Yes, so that's a great question. I have had folks ask me that. I actually became interested in counseling through kind of a less conventional means. Was originally interested in becoming a veterinarian, but then in my endeavors of bachelor's programs and such, ended up doing some research for a psychologist, Dr. Francis Shin, who is in Springfield, and we did some research looking at Asian mental health, actually, with societal stereotypes. And after I got exposed to that, I realized, wow, I like clinical stuff, and took a few more psychology classes, and then got to know some professors who taught counseling where I got my master's, and thought, oh my goodness, I actually really like counseling instead of maybe just psychology. And then the world led me here. Uh, so that was um, kind of my non-linear trajectory from veterinarian to counselor.
Right, I did not know that about you.
Yeah.
You're going to be a veterinarian.
Yes.
All right, so then what schools did you go to then for your undergraduate, graduate, and postgraduate degrees?
Sure. I actually attended Lincoln Land Community College, and I know Coresair, you and I were just sharing about your experiences and how you enjoy working in the community college and university settings. And anyway, I actually earned an associate's of biology at Lincoln Land, and then, like I said, went on to University of Illinois Springfield, and thought, oh well, I might get a bachelor's in biology, and realized no, I actually really like psychology. So then earned a bachelor's at UIS in psychology, and then I stayed there, and I worked as the teacher education department grad assistant while I earned my master's of human development counseling at UIS. And then not too long later, I had a little gap in between, um, but not very long actually. Then I went on to Northern Illinois University, where I earned my PhD, as you know, in counselor ed and supervision. And that was in 2018. And since then have been excited and lucky to get licensed in PA in Illinois.
All right, perfect. So, with that being said, because I know you had a little bit of an interesting journey when it comes to jobs. So, I hope you could share a little bit with us of what places did you work starting off in your profession and what did you learn as a result from working at those places?
Yeah, and Coursera, I know it's been a few years since you and I have talked about this, but when I taught classes, I think I shared a little bit about my beginning clinical journey. I now, well, fast forward to now, and then I'll backtrack. I now will actually start a position in August at Quincy University as a counselor educator, while I also actually work for myself for what's called Empathic Empowerment, PLLC. And it's a small telehealth practice that actually just officially started up. I was doing some telehealth through BetterHelp, and then through some other employers, after kind of some agency work that I'll talk about in a minute. But to get to that, to get to kind of full licensure and to telehealth stuff and then counselor education, I started off right after my master's, continuing some work at what was called Christian County Mental Health Center in Taylorville, Illinois. And I worked, and it also was where I interned, but worked with crisis care, kind of high acuity clients who had vague and fleeting or higher levels of suicidality, or doing like providing some help in their psychosocial rehab groups. I've also had some intern experience though there, as well as a place called A Plus DUI Services, and a place that also is now closed but called Ascent Counseling, where we worked with mandated clients. And so all of those experiences were really, really rich, not necessarily monetarily, uh, but as far as client demographic. And then after that, as you know, Coresair, I helped out a little bit as a doctoral student in what's called the CCTC at Northern Illinois University. And I also worked and accrued actually some of my postmaster's hours at something called the CCS, Counseling and Consultation Services, also at Northern Illinois University. Um, so yeah, it's been an interesting trajectory because I've come into the counselor education world, but I really want to preserve my clinical skill and working with clients to just, there's a colloquial saying sometimes that misrepresents teachers, that if you can't do it, you teach it. And I don't want to fulfill that misrepresentation.
All right, understandable.
Yeah.
So, with that being said, now that I know that you actually have a PLLC, I want to ask you something about that in a little bit. But before we go to that, I know that, well, at the time when I sent you these questions, you were working at Gannon University.
Yeah.
So I know you mentioned you were here in Illinois, then you moved over there. So what was that process like that led you to want to work at Gannon University?
Yeah, I think that's a great question. And I will say, for folks who are starting out in counseling and perhaps wanting LLC or PLLC, I am quite not the expert. I've just started my PLLC, but I can at least share some tips that I've learned by finally getting that kind of stamped approval from the state. Um, but kind of going back into the academic realm and thinking about Gannon, um, goodness, there were a lot of things that intrinsically, as well as a couple extrinsic incentives, that influenced me to want to work in the professorial position, as well as specifically at Gannon. So my first job actually coming out of the doc program, technically was and I still do some part-time work for Northwestern University, but I had originally worked Coresair when I was what they call all but dissertation at LaSalle University, which is actually in Philadelphia, PA. And it was awesome. Um, in fact, there's a ton of opportunity for helping clients, especially in a metropolitan area. And anyways, I knew that I wanted to work as a counselor, but I also wanted to influence the formation of how people are treated in the academic realm to become a counselor. Um, Part of that is influenced by me being a first generation graduate student and realizing how much I've had the privilege to complete school. I want to also facilitate that for other folks. I love education. Um, so anyway, fast forwarding, a lot of that why is what really triggered me to, earn my PhD and then start at LaSalle University. And again, I have some near and dear colleagues there. One of them I actually term a professional bestie, Dr. Nina Mendez. She's still at LaSalle University. But anyways, for family reasons and honestly just cost of living, things like that, I was kind of looking at other institutions, other locations, and Gannon University actually reminded me a lot of the university of where I had earned my master's, UIS's master's. They have a somewhat urban area for living, but it also has a rural feel where it's kind of a more intimate cohort, smaller class sizes. And so, I kind of took a shot in the dark and I applied, and I was super blessed to get the job there, and have actually been there for about 2 years, and found another program. Fast forward, because I do all of these things very fast apparently. Um, but I'm actually headed to Quincy University, extrinsically, in part because again, some family changes, some family health changes, but excited to work at Quincy University for some similar reasons as I was to working here at Gannon, that it's a what we call kind of a small but mighty program. It's a small program, but there's a ton of rigor. Both programs are CACREP accredited. Um, both leaders at Gannon and Quincy have both been in their state organizations. One of my kind of my boss, but my colleague, my chair at Gannon has been president of the Pennsylvania Counseling Association, and kind of a parallel at Quincy, Dr. Oliver has done a lot of work with the Illinois Counseling Association's journal. And so anyways, they both have a lot in common. I don't want to conflate them, but was really excited to go to Gannon to try to pay it forward to help students who maybe weren't as privileged to come into higher ed to see all that higher ed could do, while also then passing on the clinical skill of, hey, how do we be with people as counselors? It's my really long-winded answer, Coresair.
No problem. That was amazing. So if anybody from Gannon or Quincy is watching this, please give her a raise because she talked you both up a lot. Right.
They've both been very good to me. Yeah, again, there were some family changes as to why I'm moving, but super excited for Quincy saying yes, because they have, like I said, a small but mighty program, and Gannon's been really good to me. So yes, shout out to both of them. Not because I need a pay raise. I mean, Corsair and I wouldn't mind the money. You guys could give us both a little commission for sharing.
Right. Exactly. All right. So throughout your time teaching, what would you say is your favorite class to teach?
Yeah. So Corsair, you did not take this class with me. So it's funny that I'm going to say this, but it's been like 5 or 6 years since I've seen you. I actually love teaching the child and adolescent counseling class. I didn't even think I would ever love teaching that class. Um, that was not my expertise. Since then, I have worked with a decent amount of children actually through either telehealth means or yeah, through really telehealth means mostly. I did work with a few clients at Christian County Mental Health who were young, but I actually love teaching the child and adolescent counseling class. And part of the reason is because I actually have really kind of gotten into, understanding the trauma informed concepts, that it's not questioning any client, not just a young client, but it's not questioning a young client per se, what's wrong with you. It's more so asking like, hey, what happened? And to me, that's much less pathologizing, and it's much more contextual to say, hey, we all grow up with some sense of stress or trauma, and yet some of us, for whatever societal reasons are viewed differently than others. And so what is this? What does that mean? What does trauma do to us? How can we be shaped? How can we be resilient after we're impacted by trauma? And so obviously starting as early as possible when someone's young, to me, is maybe best. Uh, so I love teaching that class because we infuse a lot of trauma informed stuff in there. Some of my students do their own sand trays to kind of see, what was their inner child, who was the hero in their story when they were younger. So shout out to Dr. Charlie Myers, who really got, I know, a lot of us at NIU into sand tray. And since that time, I've become certified as a clinical trauma professional and all that groovy stuff, but I've actually really gotten into it myself. So I'm writing a book with a couple colleagues from Northwestern University, actually, Noelle McKillop and Carolyn Powell, and not trying to like create promotional anything, but just awareness. It'll be titled The Young Brain Built on Trauma, actually, and I'll bring the trauma perspective, and Carolyn will bring kind of the developmental personality perspective for kiddos, and then my buddy Noelle is writing a lot about neuro-informed counseling in it. So I'll have to give you a free copy, course there.
Oh,
Not because
perfect.
they're like just to let people know that it's out there, but
Mhm. Oh, yeah, definitely. I would love a free copy. I love free things, so I'll definitely take it.
yeah, I certainly, and like folks who are watching this can email me. I can give you guys a free copy. You don't have to, it's not like a promotional thing. It's more to just say like, this is why I like it. Cause I think in the counseling field, we have a great knowledge of trauma, but we're still like a lot of other professions. I would say any profession that we don't fully understand trauma. So,
Yeah, definitely. So we'll circle back to that in a second because now I found out all these other things I got to ask you about. Right. But in regards to reciprocity, that's one of the biggest things that we're working on here in Illinois, especially with the counseling compact. So, how was the reciprocity process when you transferred over to Pennsylvania?
you know, it was messy, and I don't want to say messy on the part of either state. I just think because there's not reciprocity or portability, it's just inherently messy. Um, it was it was less messy than colleagues I've heard about who have maybe transitioned to other states. But it was messy, and what I mean by that is for folks who are interested, perhaps in obtaining dual licensure in Illinois and or PA. Um, Pennsylvania is one of those states that does not have what we call a two-tier license. So in Pennsylvania, their LPC is equivalent to Illinois' LCPC. And so, kind of a very brief rundown is when I originally applied through what's called endorsement, that a lot of students, or not students, excuse me, that a lot of professionals will uh, apply for if they're like getting a dual license somewhere else. Anyways, there was a lot of confusion with kind of me having the extra LCPC, and then also another extraneous variable in all of this is I took the NCMHCE very, very late, and so that was like in process. But anyways, Pennsylvania didn't even know why I was like sending those items. They're like, well, LCPC, what's that? And it wasn't until I got on the phone with a couple of the state clerks to share that actually our LCPC is the top tier. It's not the first tier. And so I think there was some confusion. So that's not, that's not at all to kind of blame the state of Pennsylvania clerks. They were kind and helped me. But I think it goes to show why we need reciprocity, because it's just such a convoluted system that people don't know every single state for when other folks transfer in. So it was a little messy and it took a little time, but after talking it through with the state of Pennsylvania and then also keeping my Illinois license, it's been okay, but it was a little messy.
Sounds messy, but
Yeah.
thankfully you were able to make it through it. So that's
Yes, and
great.
it worked out. It actually helped me for helping students know, like, hey, how do you perhaps get like a dual license? Um, which I know a lot of us, might be, especially given that a lot of us work via telehealth now.
Yeah, exactly. All right. So then circling back then to your PLLC, could you name it one more time, please?
Yeah, PLLC. Empathic Empowerment Counseling. I would
Okay.
love if people want to get on there and look for it. It's extremely new. In fact, just a couple weeks, if not even a week or two ago, we were finalizing. I have a lawyer that's helped me in process and what's called a registered agent, but I was collaborating on, the very professional LinkedIn and Facebook to make sure my colleagues had kind of heard about this before. Um, because some counseling private practices in Illinois, for example, have LLC, which is okay. But for me, especially because I have a doctorate in counseling education, it was a little bit more practical and congruent and kind of easier logistically to do what's called a PLLC, which is a professional entity LLC. It's legally it fits a little better for my situation, if that makes sense, um, than LLC.
Yeah, definitely. So then I always ask this for people that come up with different names for their private practices. So what was your process? How did you come up with your name?
Goodness, I should bring my husband in here because he can attest that I toyed around with it for months. Yeah, a lot of it honestly was a lot of introspection, which sounds really corny, but it really was. Obviously, logistically, if folks are watching this for kind of the practical steps to maybe start a business, one thing logistically that you want to look for, which helps to either have a registered agent and or a lawyer, and or just colleagues who have been knowledgeable about this, but you want to make sure there's not a facility in your state, most likely, at least in Illinois, um, that also has the same name. That's kind of a rule out. You can't legally use a company's name if it's already being used in Illinois. So obviously that's going to influence, what I had thought of, but I kind of got lucky, and empathic empowerment counseling was actually the first choice. And so for myself, knowing that I am a practitioner scholar, I love to emphasize scholarship, but first I identify as a practitioner. I identify as a counselor educator, not educator counselor kind of thing. I knew I wanted in my company's name to have some essence of how I do my clinical work. And so I really value empathy. I think empathy is simple but difficult. Um, and so I knew somewhere in there I wanted to emphasize empathy, actually. And so, anyways, after months of asking my husband all of his thoughts, probably about 50 million times, as well as texting a couple colleagues, as well as writing it out, came up with empathic empowerment counseling, and then obviously making sure it wasn't taken in the state.
All right, perfect. Well, that sounds like a lot better story than how I came up with mine. I
How did,
just came up with because it sounded cool.
oh,
But
well, no, that's cool. See, I make it sound professional, but that's pretty much what I did too, Corsair, just with
okay.
a lot longer perseverating.
All right, perfect. All right, so before we get into the final three questions, I want to circle back around to your book. So first, I want you to, well, I don't know if you guys came up with an official name for it, but I think you mentioned you did, but also talk about why you all came together to write the book. Like, what was that process like?
Yeah, yeah. So actually, when we talk about, um, I feel like this is going to sound so corny, but I really mean this. Outside of being a mom, which I'm gonna say this, and I'm in the toddler stage where I just am having so much fun with my daughter. But being a mom to me is my favorite job in the world. But second to that, I would say is being a counselor and being a counselor educator. It's a friggin' awesome job. Um, so I had done some part-time work at Northwestern, and I still do, kind of given when life allows me. Um, but I had supervised a couple students, and I had also temporarily taught a couple sections of their research or theories class. And I had a couple past students, Noelle McKillop and Carolyn Powell, who Noelle was, I believe she was in theories and research with me, actually, coincidentally. And then Carolyn was in what we call reflective practitioner supervision. So basically, like her practicum. Anyways, I kind of had been a mentor to them. We had collaborated, but kind of, after a couple years went by, I had my child, blah, blah, blah. They had, asked me maybe for references here or there. Um, but I think we all shared in common that we're all interested in trauma stuff. And they knew that I had shared with them about like just different things, like my interest in different things. And anyways, you know, really this kind of got catalyzed through what is called Noelle's capstone for her master's. She had asked me when she was done with classes and such. She said, at the time I was Dr. Parker, she said, Dr. Parker, will you help me with my capstone? And her capstone was looking at adolescent trauma through kind of a neuro lens. Um, and I said, oh my gosh, I would love to. And so I helped Noelle to really shape her capstone to, not just APA formatting, but to thinking about kind of some of those pieces that were not really taught in counseling. Maybe it be a little bit more of the neuro-informed stuff that like Dr. Field and Dr. Beeson and, oh goodness, Lori, who's renowned in the field. I can't remember her last name at Bradley. But anyways, that all of them are sharing in our field, but just there's still a dearth of research because, that's not a lot of people. Anyway, so Noah and I kind of had this bi-directional relationship where I'm learning from her and I'm teaching her how to write this capstone and, sharing with her just some of the salience for what this would look like for actual clients. And so it morphed into like this much bigger thing. It's actually morphed into specifically two articles, Corsair, that have been published, as well as this other book. And then Carolyn has come in because Carolyn was also someone we both knew, was super interested in development. And I said, oh my gosh, we all should write a book. We sit and talk for 4 hours, every other week, and we have all these thoughts. We should put it on paper, see if anybody wants to read this. And it's not just thoughts, but anyways, so the two articles, if anybody is interested, one is actually they're both in the Family Journal. I forgot. They're both in the Family Journal, and one is looking at neuroinformed family interventions, and then the other one is looking at advocacy for BIPOC LGBTQIA youth, which you might be like, well, what? Like, Lucy, how is this related? But Noelle is a huge advocate, as well as Carolyn. And so when we were writing her capstone, we were just looking at, like, oh my goodness, what would neuroinform look like for like this marginalized demographic or this demographic? Anyways, this thing got so big, Corsair, that we're like, oh my gosh, this is not just a capstone. We have to cut it down. Um, but a lot of what we had in there, apparently people have liked and have said, hey, this is publishable. Let's share this with folks. And so fast forwarding to today, um, that mixed with some of our recent clinical experiences, as well as um, all three of our recent trainings in trauma, we've been like, hey, we need to write a book, because there's not, in counseling ed, there's not a ton specifically with children in trauma that is explicitly taught about. So again, another really long-winded answer, but that's how we kind of came about thinking of this book.
All right, definitely. And then, did you guys come up with a book title yet?
Yeah, it's we actually got accepted for publication, hopefully July 2024. I actually am going to send the first 5 chapter drafts to our partners here probably later today, actually. But the title is called The Young Brain Built on Trauma. So it will integrate expressive arts therapies in a way that really, not just expressive arts. I mean, there are lots. We're going to talk about EMDR, we're going to talk about expressive arts, but all types of kind of therapies that we anecdotally and professionally and empirically know about with kids, but looking at them through a neuroinformed lens, and also looking at trauma, the impact of trauma for kids and adolescents through a neuroinformed lens. So anybody who's interested in working with kids or just interested in understanding trauma, please, either check out the book or check out some of the things we cite, because it is some valuable information in there.
Yeah, definitely. All right. So, with that being said, unfortunately, all good things must come to an end because we're down to our final 3 questions. All right. So, before we get to the most important question, which is the last one, is there anything that you would like to tell people starting out in the field or who have been in the field for a while?
Oh, yeah, goodness. I would have a lot of things I might want to tell them, but I need to be somewhat succinct so you can actually, not have a 15-hour interview here, Corsair. Um, I would say, I know this is said very often, but I don't think the prevalence will dilute the importance of it. I think trust yourself, actually. Be open enough to be malleable about when you do something that needs improved, and trust yourself. I think I think there can be this impression upon a lot of young counselors, who might have kind of imposter syndrome and they don't trust themselves. Um, and then I also think too, with folks who have been in the field longer, there can be a bit maybe defensiveness of being open. And so if there can be a dialect somewhere in there, trust yourself enough to be confident in yourself, as well as be open enough to maybe take some feedback, whether it's gaining cultural humility about something that we don't know. But I would say trust yourself and be open.
All right. Perfect. Great words. Great advice. I love it. All right. So, then before we get to our most important question, second to last one here, is there anything that you would like to say that I haven't had a chance to ask you?
No, I would just say thank you for having me, Corsair. I was delighted when you asked me, and I'm excited to get to know what's going on in Illinois since I'm moving back to your area.
All right, perfect. All right, so then the last question and the most important one, right? A little bit of a drum roll. But where can people find or contact you if they want to get connected?
Yes, I do have a professional phone number, but I don't know if folks are like me and will forget. So I might give you the link to my private practice if that's okay, Corsair, and it's basically empathic empowerment counseling.com. Um, but I'll also give Corsair the link because I'm sure I'm not telling people about like the hyphens and such. But I would love it if folks want to email me. There is a contact me section in there. um, I also will have a professional email outside of empathic empowerment at Quincy, but I'll give folks and I'll give this to you too, Corsair. My private practice email is actually, it's very long, but it's empathic empowerment counseling at gmail.com. So please email me there. On my private practice website, though, there is a professional phone number if anybody wants to call. And I don't have my Quincy email right now, but if folks are maybe wanting to talk about research or things that are indirectly clinical but maybe more scholarly, uh, let me know. I'm happy to answer you via that email.
All right, perfect. Thank you very much. All right, so
Thank
you
you.
heard it first, everybody. Contact her, get all the help you can get, and utilize her knowledge and information and resources.
Oh yeah. Thanks,
All right,
Corsair.
yeah, no problem. All right, so that'll conclude today's interview. Again, this is Coresair Mack, President of the Illinois Mental Health Counselors Association, signing out, and I will see you all in the next interview. Take care.